One of the most important things every nursing student must understand about HIV is that the virus itself is often not what causes the greatest danger to the patient. The real threat develops when the immune system becomes so weakened that the body can no longer defend itself against infections that a healthy person might normally fight off without difficulty. These are called opportunistic infections because they take advantage of the opportunity created by a compromised immune system. Understanding this concept is critical not only for NCLEX success, but for becoming a safe, knowledgeable, and compassionate nurse in real clinical practice. When HIV attacks the body, it specifically targets CD4 T helper cells, which play a major role in immune defense. Over time, if HIV is untreated or poorly managed, the CD4 count begins to fall. As those protective immune cells decrease, the body becomes more vulnerable to bacteria, viruses, fungi, and parasites that would not normally cause severe illness in someone with a healthy immune response. This is why opportunistic infections can become life-threatening very quickly in patients living with advanced HIV disease. Many nursing students initially memorize opportunistic infections as isolated facts for exams, but true understanding happens when you connect the infection to the immune system itself. The lower the CD4 count becomes, the weaker the body's defenses become. This creates a dangerous situation where infections can spread aggressively, symptoms may appear suddenly, and recovery becomes more difficult. That is why nurses must recognize early warning signs and act quickly. For example, a healthy individual may recover from a mild respiratory infection with rest and hydration, but a patient with severe immunosuppression may develop life-threatening pneumonia. A simple fungal organism that normally exists harmlessly in the environment may suddenly cause overwhelming infection in an HIV patient whose immune defenses are exhausted. This is why assessment skills are so important. Nurses are often the first healthcare professionals to notice subtle changes in breathing, mental status, oral lesions, fever patterns, weight loss, or fatigue that may signal a developing opportunistic infection. Another important reality we must understand is that opportunistic infections do not only affect the body physically, they also create emotional and psychological challenges for patients. Many individuals living with HIV already face fear, stigma, anxiety, and isolation. Recurrent infections, hospitalizations, and declining health can make patients feel hopeless or overwhelmed. As nurses, we must never allow medical knowledge to replace human compassion. Clinical excellence and emotional support must work together in patient care. This is also why patient education matters so much. Teaching patients about medication adherence, follow-up appointments, infection prevention, nutrition, and recognizing early symptoms can significantly improve outcomes. Antiretroviral therapy has transformed HIV care and allowed many patients to live long, productive lives, but treatment success depends heavily on consistency and ongoing healthcare support. Nurses play a major role in reinforcing that education every day. In nursing school and on the NCLEX, you will often see questions testing your ability to connect symptoms, CD4 levels, and infection risks together. But beyond the exam, remember that these are real patients trusting healthcare professionals during some of the most difficult moments of their lives. Your knowledge can protect them. Your assessment skills can save them. Your compassion can strengthen them emotionally when they feel vulnerable. The strongest nurses never see opportunistic infections as just diseases to memorize, but as critical warning signs demanding skilled, compassionate care. One of the biggest challenges nursing students face when studying HIV opportunistic infections is feeling overwhelmed by the number of diseases they must remember. There are bacterial infections, fungal infections, viral infections, and parasitic infections, and at first, it can seem impossible to organize all of them clearly in your mind. But once you understand the patterns and recognize the common infections nurses see most often, everything becomes much easier. The goal is not simply memorization. The goal is learning how to recognize dangerous clinical signs quickly and respond with confidence. One of the most important opportunistic infections every nursing student must recognize is Pneumocystis jirovecii pneumonia, commonly called PCP pneumonia. This infection is extremely common in patients with severely weakened immune systems, especially when CD4 counts fall below critical levels. Patients often present with shortness of breath, persistent dry cough, fever, fatigue, and low oxygen levels. What makes PCP especially dangerous is that symptoms can gradually worsen until the patient suddenly experiences severe respiratory distress. Nurses must recognize these warning signs early because delayed treatment can become life-threatening very quickly. Another major opportunistic infection is oral candidiasis, also known as thrush. Many students underestimate its importance because it appears less dramatic than pneumonia, but oral thrush can be one of the earliest signs of immune suppression. Patients may develop thick white patches inside the mouth, pain while swallowing, redness, or difficulty eating. As nurses, we must understand that even seemingly minor symptoms can signal deeper immune compromise. Assessment matters. Attention to detail matters. Tuberculosis is another infection nurses must always take seriously in HIV patients. When the immune system weakens, latent tuberculosis can become active and spread aggressively. Patients may experience chronic cough, fever, night sweats, weight loss, and fatigue. Tuberculosis also carries major infection control concerns within healthcare settings. Nurses must understand proper airborne precautions, use of protective equipment, and early isolation procedures to protect both patients and healthcare staff. Students must also recognize the danger of toxoplasmosis, especially when neurological symptoms appear. This parasitic infection often affects the brain in severely immunocompromised patients. Headaches, confusion, seizures, weakness, and altered mental status may develop. Sometimes, patients present with subtle neurological changes that worsen rapidly if untreated. Nurses must never ignore changes in mental status because those changes can be critical warning signs of central nervous system involvement. Another important infection is cytomegalovirus, commonly called CMV. This virus can affect multiple body systems, including the eyes, gastrointestinal tract, and nervous system. One of the most serious complications is CMV retinitis, which can lead to vision loss or blindness if not recognized quickly. Patients may complain of blurry vision, floaters, or visual disturbances. Nurses play a key role in identifying these symptoms early and ensuring immediate medical evaluation. Kaposi sarcoma is another condition students often associate with HIV. Although technically a cancer rather than an infection, it is closely linked to severe immune suppression. Patients may develop dark purple or brown skin lesions that can spread internally as well. Recognizing abnormal skin findings is an essential nursing skill because physical assessment often reveals important clues about overall immune function. As future nurses, remember that opportunistic infections rarely appear alone. Patients may experience multiple complications simultaneously because the immune system is struggling to protect the body. This is why nurses must think critically, observe carefully, and communicate concerns immediately. The nurse who recognizes subtle symptoms early can change the entire outcome of a patient's life. When caring for patients with HIV and opportunistic infections, nursing assessment becomes one of the most powerful tools in protecting patient safety. Nurses are often the first healthcare professionals to notice subtle changes that may indicate a serious infection developing. That is why strong assessment skills, infection prevention practices, and NCLEX safety priorities are absolutely essential. In nursing school, many students focus heavily on memorizing diseases and medications, but real clinical excellence comes from learning how to recognize danger early and respond quickly with safe, evidence-based care. One of the first priorities in HIV care is careful and consistent assessment. Patients with weakened immune systems may not always show symptoms the same way healthy individuals do. A slight fever, mild confusion, persistent fatigue, or small changes in breathing may actually signal a rapidly progressing opportunistic infection. Nurses must learn to pay attention to patterns. A patient who suddenly becomes short of breath, develops new oral lesions, experiences weight loss, or shows changes in mental status requires immediate attention. Small details matter because immunocompromised patients can deteriorate very quickly if warning signs are missed. Vital signs also become extremely important in these patients. Fever may indicate infection, tachycardia may reflect stress on the body, and low oxygen saturation could signal respiratory complications like PCP pneumonia. Nurses must never ignore abnormal findings simply because they appear mild at first. Assessment is not only about collecting information, it is about interpreting what the body is trying to communicate. Infection prevention is another critical responsibility. Patients with HIV are more vulnerable to organisms that healthy immune systems would normally control easily. This means nurses must remain strict with standard precautions, hand hygiene, protective equipment, and environmental cleanliness at all times. One of the biggest mistakes healthcare workers make is becoming careless with infection control because procedures feel repetitive. But consistency saves lives. Every hand washed properly, every glove changed correctly, and every precaution followed carefully protects vulnerable patients from additional harm. NCLEX questions often focus heavily on safety priorities, and HIV care is filled with safety considerations. Students must remember that immunocompromised patients should avoid unnecessary exposure to infectious organisms. Nurses should monitor for signs of infection closely, encourage medication adherence, and educate patients about protecting themselves from illness. Teaching becomes a major part of nursing care. Patients need to understand the importance of taking antiretroviral therapy consistently, attending follow-up appointments, maintaining nutrition, and recognizing symptoms that require medical attention. Medication adherence is especially important because missed doses can allow HIV to progress further, increasing the risk of opportunistic infections. Nurses play a powerful role in reinforcing this education without judgment. Some patients may struggle emotionally, financially, or socially with long-term treatment plans. Compassionate communication matters just as much as clinical knowledge. Patients are more likely to trust healthcare professionals who educate with empathy instead of criticism. Another major NCLEX priority is protecting patient dignity. Unfortunately, stigma surrounding HIV still exists in many healthcare environments. Nurses must never allow fear, assumptions, or personal bias to affect patient care. Professionalism means treating every patient with respect, confidentiality, and compassion regardless of diagnosis. Patients living with HIV deserve the same dignity, empathy, and commitment to quality care as every other patient. Strong nurses do more than recognize infections. They protect safety, educate with compassion, and create an environment where patients feel respected during some of the most vulnerable moments of their lives. That combination of skill and humanity is what defines true nursing excellence. The nurse who stays alert, compassionate, and committed to safety becomes a powerful force in protecting patient lives. One of the most important lessons every nursing student must learn is that caring for immunocompromised patients requires far more than medical knowledge alone. Clinical excellence is built through confidence, compassion, emotional strength, and the willingness to continue growing even when situations become challenging. Patients living with HIV and opportunistic infections are often facing not only physical illness, but also emotional fear, social stigma, uncertainty, and exhaustion. The way nurses respond during those moments can deeply impact both the patient's recovery and their trust in healthcare. Many nursing students begin their journey feeling intimidated by HIV care because they fear making mistakes or saying the wrong thing. Some become overwhelmed trying to memorize infections, medications, precautions, and laboratory values all at once. But confidence in nursing does not come from knowing everything immediately. Confidence develops through preparation, repetition, observation, and the willingness to keep learning every day. Every skilled nurse was once a student struggling to connect the pieces together. Growth happens one patient, one lesson, and one experience at a time. One of the greatest strengths a nurse can develop is the ability to remain calm under pressure. Patients with opportunistic infections can decline rapidly. Respiratory distress, neurological changes, severe infections, and sudden complications may appear unexpectedly. In those moments, patients look to nurses not only for clinical intervention, but also for reassurance. Calmness creates stability in difficult situations. When nurses remain focused, organized, and emotionally steady, patients feel safer even during frightening circumstances. Compassion is equally essential. Sometimes, healthcare environments become so fast-paced that professionals unintentionally focus only on tasks, medications, and documentation while forgetting the emotional experience of the patient. But patients living with HIV often carry invisible emotional burdens. Some may feel ashamed, isolated, rejected, or fearful about their future. Others may have experienced discrimination in healthcare settings before. That is why respectful communication matters so much. A nurse's tone of voice, facial expression, patience, and willingness to listen can either strengthen a patient emotionally or increase their distress. True nursing excellence means treating patients with dignity regardless of diagnosis. It means protecting confidentiality carefully, educating without judgment, and creating an environment where patients feel respected and safe. Compassion does not weaken professionalism. Compassion strengthens it. Patients remember healthcare professionals who treated them like human beings during vulnerable moments. Another important part of clinical excellence is teamwork. HIV care often involves collaboration between nurses, physicians, respiratory therapists, dietitians, social workers, and infectious disease specialists. Strong nurses understand that patient care improves when healthcare teams communicate effectively and support one another. Asking questions, seeking guidance, and learning from experienced professionals are signs of wisdom, not weakness. Nursing students must also remember the importance of self-discipline and resilience. Studying complex conditions like HIV opportunistic infections can feel mentally exhausting at times. There will be moments of frustration, difficult exams, and clinical situations that test your confidence. But every challenge you overcome is preparing you for the responsibility of protecting lives in the future. The discipline you build now becomes the strength patients will depend on later. The most respected nurses are not simply the ones with strong technical skills. They are the ones who combine knowledge with humanity, confidence with humility, and professionalism with compassion. Those qualities create trust, healing, and hope even during the most difficult patient experiences. Great nurses do more than treat disease. They bring strength, dignity, and hope to people who need it most.